Hey everyone, hope you're having a great day. You're listening to the RX Daily Dose. Today's episode is being recorded for Monday, April 12th, and I'm your host, Ian Parnagoni. We update this podcast for healthcare providers, medical professionals, and anyone who has an interest in drug updates. Don't forget to like, share, and subscribe on all your favorite podcast platforms and social media, including iTunes, Spotify, YouTube, and Instagram. All links can be found in the show notes below. In today's episode, the new product we'll be discussing is Qelbree for the treatment of ADHD in children and adolescents. We also have two products with new indications, and I'll just mention those two here. First is Tyvaso, with an expanded indication for treating patients with pulmonary hypertension associated with interstitial lung disease to improve exercise ability. And the next one is Sarclisa, in combination with standard of care carfilzomib and dexamethasone for treating relapsed or refractory multiple myeloma in previously treated adults. Some additional detail for everyone on the new drug this week. The FDA approved viloxazine, which goes by brand name Qelbree, an extended release product indicated for the treatment of attention deficit hyperactivity disorder in pediatric patients 6 to 17 years of age. This is the first non-stimulant ADHD drug to win approval in a decade, and it also appears to start working more quickly than its future rivals do. ADHD is a neurodevelopmental disorder affecting 11% of school-age children. Symptoms can continue into adulthood in more than 3/4 of cases. ADHD is categorized by developmentally inappropriate levels of inattention, impulsivity, and hyperactivity. Proper identification, treatment, and recognition of the disorder is key. ADHD may have serious consequences, including education, family stress and disruption, depression, problems with relationships, substance abuse, delinquency, accidental injuries, and job failure. Qelbree is a serotonin norepinephrine modulating agent. Its mechanism of action with ADHD is unknown, but it's probably similar to other non-stimulant products on the market and thought to be related to selective inhibition of the presynaptic norepinephrine transporter. Qelbree, which is manufactured by Supernus, will have to compete for space in a market crowded by Eli Lilly's Strattera and Shire's Intuniv, both of which have cheaper generics on tap. Intuniv was the last branded non-scheduled ADHD med to win the FDA's blessing way back in 2009. Since then, a suite of low-cost copycats have swept the market. The case is the same for Eli Lilly's Strattera, which posted $535 million in U.S. sales in 2016. That was the last full year before generic rivals entered the equation. Qelbree won't beat out these drugs on price alone, but Supernus has laid out plans to boost the med's profile. Beyond education efforts, the company will offer samples of Qelbree to patients and doctors interested in testing out the new drug, something that simply wouldn't be possible with a stimulant-based medication. And while there isn't any head-to-head data, Qelbree appears to sidestep the rare liver toxicity and hypotension concerns of Strattera and Intuniv respectively. It could also beat out market leader Strattera on speed of action. The approval of Qelbree is supported by data from an extensive development program consisting of 4 phase 3 clinical trials that studied more than 1,000 pediatric patients from the age of 6 to 17 years. In March of 2019, the company unveiled phase 3 data that showed its 400 milligram dose had bested placebo at reducing the ADHD symptoms in adolescents, while a 600 milligram dose narrowly missed statistical significance. Notably, Supernus said that the 400 milligram dose charted statistically significant onset of action at the 2nd-week mark, which continued until the study ended at week 7. In fact, the drug could start to improve symptoms within the first week. That could give Qelbree an edge over Strattera, which takes some 4 to 8 weeks to start working. Along with other products in the class, Calbree comes with a boxed warning and may increase suicidal thoughts and actions in some children with ADHD, especially within the first few months of treatment or when the dose is changed. Caregivers, parents, and healthcare providers should pay close attention to any new or sudden changes in mood, behavior, thoughts, and feelings. Qelbree should not be taken by patients that also take certain antidepressants, especially monoamine oxidase inhibitors. The most common side effect recorded during clinical trials are somnolence, headache, fatigue, and decreased appetite. And that's all I have for right now. I hope you enjoyed today's episode. I'll include all links in the show notes below, so please go back and check those out too. Please connect with me on any of your social media platforms and give me feedback on what you heard today. I'd love to know what you thought about the episode. And as always, feel free to like, share, and subscribe wherever you listen to your podcasts. And thank you so much for tuning in. Stay safe out there, and I hope you enjoy the rest of your day.